So I have tried to make the lecture interesting. As you know, a very important topic, right? So first of all, welcome to MBBS. Now you have to move from that phylum Pteridophyta, Coelenterata and all that to something new, which is very different from what you may call as a non-medico. So there is certainly a difference between a medico and what we can call, in a non-derogatory way of course, non-medico. So I like to call this multiverse of madness. Okay, so you will have so many subjects. Right now everyone wants to be a cardiosurgeon, neurosurgeon, and by the end of final year you will be like, koi bhi milega PG chalega bhai. Right? So welcome to this madness. Hopefully you have a good journey in the next few years. And what this objective of the lecture is, I'll demonstrate the correct technique of hand hygiene, the use of personal protective equipments, that is PPE, how to handle sharks and their disposal, and post-exposure prophylaxis. So that is PEP. So understand difference between PPE and PEP. Okay. So what used to happen before COVID-19? All the surgeons, physicians, we as infection control specialists used to tell them by hand hygiene karo, PPE dalo. They used to say, ये मेरा expertise नहीं है, I am out. मेरे को time नहीं है इसके लिए. I have 200 patients to see. अभी क्या मैं hand hygiene सीखते बैठूं क्या? Understood? What happened after COVID? सिर्फ बंटी बचने वाला है. So, very important aspect, hand hygiene. Now it is, even the common man knows about it. Even children are taught this, which was always important, but COVID taught, the fear of COVID taught the doctors more than what we have been trying to teach them since years. Okay, so it is a very important concept, hand hygiene. So there is something like universal safety precautions. This we are going to cover on 23rd. So you have another session on that, but I'll just run through. These are the main components. First is hand hygiene. Second is barrier precautions. Third is safe handling and disposal of sharks. Fourth is management of spills. And lastly, management of exposure. So you might not encounter all this in the first year itself, but certainly when your clinical postings start and your exposure towards the clinical side of medical curriculum starts, then you will need to follow all these concepts. So please pay attention very well. So hand hygiene, everyone now knows about it. It has been the topic of discussion since the last 2 years, especially due to the COVID-19 pandemic. So, where is the facility? Has anyone been to the wards yet? I don't think so. So, if you see the wash basins in the wards, you will feel like never using them. Right? Soap not seen in the wards, and water is okay. Towel is very bright and shiny white. Right? So, you don't feel like using it at all. So what you can do is, you can use a alcoholic hand rub. No water needed, no soap, no towel needed. So what is more important is the technique rather than the agent for hand wash. Understood? So there are mainly two agents. One is soap and water and other is a alcoholic hand rub. Clear? So you can use either of them. What you use is not important. How you use, that is more important. Is it clear? Only thing you should know is, if there is visible dirt on your hands, like dust particles, or you have done some procedure where there is blood or pus, etc. on your hands, then you have to always do a soap and water hand wash and not alcoholic hand rub. Why? Because alcohol does not act in presence of organic material. So if your hands are visibly clean, you can go for a alcoholic hand rub. If your hands are dirty or at the end of the shift preferably, you will go for a soap and water hand wash. So if you do not do a hand wash properly, these are the areas which you frequently miss. So how do you do hand wash? Just demonstrate everyone. How do you do hand wash at home? अभी कोविड की वजह से सबको थोड़ा तो आ रहा है. नहीं तो क्या करने का, पानी लिया, हो गया मेरा hand wash. So if you do hand wash like this, what happens? You miss these areas. And for us to keep our patients safe, to keep ourselves safe, we need to do a proper hand wash. We cannot even afford to miss any area of our hands. So there is something like known as residential flora of our skin, and there is something known as transient flora of the skin. So residential flora is in the deep layers of the skin. Understood? So they are not transmitted easily. They are very deep, and they are generally the good bacteria which compete with any pathogen. And there is something known as transient flora, which is just there for a small time at the superficial layer of the skin, and this is something which will transmit or transfer from one patient to the another. Have you heard about Staphylococcus aureus? Yes. So there is a very important bacteria in the hospital setting known as methicillin resistant Staphylococcus aureus. So suppose if I have palpated one patient who is having MRSA infection, so that will become, MRSA will become transient flora of my hands. And then I go and touch the second patient, what will happen? I will transmit MRSA from one patient to the other. And that second patient may get an infection. These are known as hospital acquired infection. So if I would have done a proper hand wash in between two patients, there would be no transfer of MRSA. Understood? That is why I am telling you that I cannot afford to miss even a single area after a hand wash. Because bacteria will multiply immediately. They just need a small nidus to grow. Okay? So what are the steps? So everyone is going to do it with me. Okay, I will demonstrate. You have to do it with me. First, I will show how to do with soap and water. Okay, I will tell you how to do with soap and water, and I will demonstrate it on the alcoholic hand rub. Timing wise, for soap and water, it should be minimum 45 to 60 seconds. तेरा साबुन स्लो है क्या, फास्ट है क्या, कुछ मालूम नहीं, 45 to 60 seconds होना चाहिए. Alcoholic hand rub, alcohol acts very fast, so you can do within 15 to 20 seconds. Is this clear? How to do a soap and water hand wash? You first start the tap, let your hands get wet from both sides, take the soap, lather, prepare the lather such that it covers the whole area of your hands. And then now everyone is going to do with me. First step is palm to palm. Very good. Palm to palm, back of hands. So back of both the hands. In between the fingers. कौन नहीं कर रहा है पीछे? In between fingers, knuckles. Knuckles you have to do like this. For both the hands, knuckles. Then very often missed, it's the tip of fingers. So you have to wash both the tips of fingers. Okay, and thumb. And lastly the wrist. Clear? So the sequence is not that important, but you should cover all these areas. And very important thing you should note is no ornaments. Because what will happen, bacteria were beneath this ring. And when I did hand wash, it never reached below the ring. So if any bacteria is there, it may still transmit. So no ornaments, your cuff should be folded, no wristwatch, no bracelet, nothing. Understood? During patient care. For a surgical hand wash, obviously it extends up to elbow. That they will teach you when you in surgery. But this is a normal medical hand wash. So everyone is clear? Now the same thing, this all process should take 45 to 60 seconds, like I said. Same thing with alcoholic hand rub. What I will do, see, I'll demonstrate. I'll keep this here. Now what I should do, should I push it like this? What will I prefer? I'll keep it here. So I'll prefer pushing it by the back of my hands. Why? Because palm is likely to be contaminated. I have touched one patient. Now my palm is likely to be contaminated, right? So I will use back of my hands and have two pushes. 1, 2. So that I can cover the entire, both the hands properly. Understood? One push mein nahi hota if you try using. Then again do it with me. Palm to palm. Back of hands. In between fingers. Knuckles. Tip of fingers. Very important. Because so much dirt is there in the nails. Thumb and wrist. Okay. So आज अभी लंच हो गया. डिनर के पहले भी ऐसे ही करोगे हैंड वॉश. डिनर के बाद भी ऐसे ही करोगे हैंड वॉश. So it comes to you subconsciously. If you practice this daily, it will come to you subconsciously. Clear? So with alcoholic hand rub, again the same method, and that is for 15 to 20 seconds. Now I told you how to wash hands, right? The technique of hand hygiene means how to wash hands. But when to wash hands is also equally important. So these are known as the 5 moments of hand hygiene by WHO. Okay, so there are 5 moments of hand hygiene means when to wash hand. So what are they? Before touching the patient, after touching the patient, before any aseptic procedure. What do you mean by that? If you are going to introduce an intravenous catheter, understood, or you are doing some kind of procedure like dressing, where you cannot afford any bacteria to be there on your hands. And fourth is after exposure to body fluid or blood. So you have to understand why I told difference between medico and let's say a commoner. That is, you will be exposed much more than them to very dangerous organisms like hepatitis B, hepatitis C virus, HIV virus, which is there in the blood as well as body fluids. What do you mean by body fluids is cerebrospinal fluid, pleural fluid, ascitic fluid. You have heard these terms, right? So these viruses or any other pathogens can be in these specimens. So if you have been exposed to them, then you have to immediately perform a hand hygiene. And fifth, very important, which many of us forget, is after touching the patient's surroundings. Like you have touched the patient's file, or you have touched the patient's bed, you have touched the trolley, IV stand. So that might also have hospital bugs or microorganisms which will be more resistant to antibiotics. Understood? So whenever you do this 5 things, you have to do hand wash. So again we will repeat: before and after touching the patient, before doing a aseptic procedure, after exposure to blood or bodily fluids, and fifth is after contact with patient surroundings. Clear? What is going to happen? For whom we are doing this? So that transmission from one patient to other patient does not happen. Like I said, MRSA, transmitting from one patient to another. Plus, it is for our benefit also. Understand this, you are going to work from henceforth in a very highly potentially infectious environment, and those at our homes may not be exposed to such organisms. So when you go home, suppose you have in the second year, you have done clinical posting, you saw the patients, touched the patients, palpation kiya patient ka, and then without hand wash you went home, and there is a child in your home or there is an elderly person in your home which have never been exposed to such antibiotic resistant organisms, so they may get the infection. So take this very religiously and follow hand hygiene wherever possible. And like I said, 2 pushes of अल्कोहल बेस्ड हैंड रब. अभी हम लोग क्या करते हैं, वो छोटा सा डेटॉल का लेते हैं 100 ml वाला, और उसमें भी 1 ड्रॉप कंजूसी करने के लिए. सो दैट इज नॉट गोइंग टू वर्क. यू हैव टू कवर एंटायर हैंड एंड नॉट मिस एनी पार्ट ऑफ इट. क्लियर? हैंड हाइजीन इज क्लियर. सो व्हाट टू यूज? सो इन वर्ड्स यू विल सी दिस सोप which has been used by Ramesh, Suresh, Mangesh, everyone. So all the bacteria are there on that soap. So preferably liquid soap with a dispenser, so that every drop which comes is fresh, is untouched. And preferably use the dispenser by the back of your hands. Always remember. Plus the tap also, you just put some amount of water on the tap, because everyone uses that tap. Betadine scrub, especially if you are going for a surgical hand wash, or you can prefer an alcoholic hand rub. वो herbal hand rub, all those don't work. It is all gimmick. हाँ, कोई बाबा बोला रहेगा काम करता है, फिर भी वो नहीं काम करता है. Okay, so you have to, there is a proper composition of hand rubs which is given by WHO. That is 70% alcohol should be there. So alcoholic hand rubs and there are certain other preparations which also work. So you should be aware of this. Why to wash? I have already told you. So about even a single 20% increase in hand hygiene compliance will reduce the hospital acquired infection by 40%. Imagine, just a small 15 to 20 seconds of your time will improve the patient care a lot. Why we are teaching you all this? Because it is a team effort. Imagine I am the surgeon, I am doing hand wash properly. My nurses, they are doing the dressing of the patient, they are doing hand wash properly. But you as second year students going to the posting and not doing hand wash properly and touching each and every patient, all our efforts are going to go in vain. Do you realize that? So when you also follow the proper hand wash, then the entire outcome will be good. So please follow hand hygiene sincerely. It is a request. Next is personal protective equipments, that is PPE. So gloves, if I use gloves, still you have to do hand hygiene, because there are minor cuts which you may not be aware of on your skin, and once you wear gloves, these bacteria will multiply, they get a good environment to multiply. So when you remove gloves, actually there are more bacteria on your hand. Clear? So you have to wash. So what do you mean by personal protective equipment? Last 2 years you have seen that pic na? Space suits ऐसे white color का डाल के सब लोग घूम रहे. That is a PPE kit. Okay, when it comes in, when many personal protective equipments come in form of a kit, it is known as PPE kit. But PPE can also mean just a glove. Understood the difference? Personal protective equipment, when it comes in form of kit, it is PPE kit. Why I am telling you? Because now it is a habit. PPE bola to, you will imagine the full kit. That is not so. So there is something known as donning and doffing. So wearing PPE is known as donning. Removing the PPE is known as doffing. Understand this with logic and common sense. Donning will be simpler than doffing. Why? Because when do you do doffing? When you have finished your clinical work, now you are exposed, now your surface is likely to be contaminated, so you are likely to transmit infection. So which surfaces will be more contaminated? Obviously your hands, which you have touched the patient or done the procedure, and your front side, and not your back side. So whenever you don and then you do your clinical work, whatever it is, posting hai, ya, when you are a resident, whatever work, or an intern, whatever work you have done, afterwards your shift is over, now you have to doff. So remember, your front side and your hands, gloved hands, are the most contaminated. So you have to remove them properly. Always remove everything from behind. Never touch, after you have done some clinical work, never touch the N95 from front. Now here there is no clinical setting. That is why I am touching. But imagine SARS-CoV-2 virus is sticking here. I have collected a swab of the patient coughed as a reflex, and now SARS-CoV-2 virus is sticking here and I am touching like this. Samajh rahe ho? So your front and outer side will always be contaminated. So always remove N95 from behind. Goggles if you are wearing, from behind. Face shield you are wearing, from behind. And whatever you are removing, you have to turn it inside out. I will demonstrate this. So, just see the pic first. So, these are various protective equipments. Cap, mask, goggles, gloves, fluid resistant apron when you are expecting splashes, like a delivery. Vaginal delivery, you might get blood which will splash, amniotic fluid which will splash, or you are doing a surgery where you expect artery bursting and splash can be there. So that time you require fluid resistant aprons, fluid resistant shoes, very important. Second year onwards, no one will wear floaters. Your feet have to be covered. Anything can fall on your feet. So you wear shoes from once your clinical posting starts. And this is the PPE kit which I told you about. So I will just demonstrate you certain important things. So this is what? N95 respirator. Rather than calling this a surgical mask, call this N95 respirator. So some of you have worn cotton mask, cloth mask. Some of you have worn surgical mask, 3-ply mask, and some of you have worn an N95 respirator. Understand the difference between the two. Cloth mask and surgical mask are mainly to prevent aerosols from going into the environment by the patient while speaking, sneezing or coughing. Is this clear? If you see them, they are not fitting well. There is gap for both surgical mask as well as cloth mask. That is why we suggest double masking, which increases the fit a bit. But when you talk about N95 respirators like this, the main purpose is protection of the wearer. Do you get this difference? Cloth mask is so that a coughing patient does not release aerosols into the environment, coughing, sneezing or talking. Whereas N95 protects the one who wears. Does that mean whatever you are doing is wrong? No. Here there is no risk. So you can use a cloth mask. But if you were going in the wards with a cloth mask, that is wrong. Understood? So when you wear a N95 respirator, I will show you doffing, because I have worn this. So for doffing, from behind you lose this strap. Take the lower strap first without touching. See, I am trying my best not to touch. So I will remove the N95 like this and discard it in the yellow bag. This lecture also you will have tomorrow. How to dispose biomedical waste. Now I am keeping here for now. So how will you don a N95? See, fresh N95. You have to keep the strings in front and hold this like a cup. Now this is clean, sterile, so I can touch the front. You have to hold it like a cup, place it on both your nose and mouth should be covered, and then I'll take the straps behind. First, I will press this nose clip. This is known as nose clip. सब लोग को मालूम है ना अभी ये. This is nose clip. So it has to be firmly pressed on your nose bridge and then tighten it from behind. So till I get a good fit. Now once I have worn this, what I need to do is known as a seal check or fit test. So I'll just cup and puff out. So when I puff out, there should be no air leaking from up or down. Unless this has happened, your N95 is as good as useless. Why? Because there is something known as aerosols, which are very tiny particles suspended in the air, less than 5 micron in size. So if there is leakage, when you breathe, these aerosols are going to go inside. Like tuberculosis spreads by aerosols. SARS-CoV-2 in some settings spreads by aerosols. So unless it is properly fitting, no use of N95 respirator. Clear? So when I will do like this, and when I inhale, you can see my N95 is collapsing, and when I exhale, it is expanding. This should happen. Then only mean it is a proper fit. Like she is trying, so it is a good fit. Okay? If it is not fitting, you tighten from behind. ये बहुत important है. Especially when you are going to do a aerosol generating procedure like a bronchoscopy or intubation. Clear? Where you are in close contact with the patient's respiratory system. Patient may be having tuberculosis, patient may be having SARS-CoV-2, which causes COVID-19. Understood? So the minute you introduce the intubation or the bronchoscope, these aerosols will come out. And if you are without an N95, then these will enter your respiratory tract. So like the N95 stands for 95% protection against these particles. Understood? So this is donning of N95 is clear to everyone. It is very important when you are going to do aerosol generating procedures. Donning of the rest is pretty simple. You just check out, I'll give you the link. Check out RRC KEMH, donning and doffing of PPE on YouTube. You will get our video. It is our own video. I'll just show you all this first. This is the complete overall gown with a hood and zip. So I'm not wearing this, but you see it in that video. You have this shoe covers. Plus you will get a bag for disposal. Plus goggles. So now I have finished my work, clinical work. Now I have to remove it. So N95, how to remove, I have already shown you. How to remove this is, you have to touch very minimally to the zip, unzip it, and then while removing, it should be removed. Imagine I am wearing it. So it should be removed like this, inside out. Understood? Why? Because this inside was the least contaminated. It was inside me. तो जैसे शर्ट निकालते हैं ना सब उल्टा हो जाता है तो that way it should be removed. So now whatever was the contaminated surface has now gone inside. And then in the end, inside out, I will fold it like this and I will put this in the yellow bag. This you see in the video. It is very well demonstrated. Similarly, gloves. So now I am donning the gloves. Okay. So when I have donned the gloves, these are not actually good fit. That is why there is a bad. See, when I don the gloves, the outer glove, if you are using two gloves, the outer glove should come over the cuff. Understood? So if I am doing some procedure, I am doing dressing and pus is there, so it will not touch my cuff. Samajh? So outer glove should always be over the cuff. Now, I have done my clinical work. Now my hand is contaminated, right? Glove is contaminated. So I will first do a hand hygiene. And now while doffing, removal. Suppose I remove this very fast. What will happen? all the infection will spread. So what I have to do is, I have to introduce one finger inside without touching the outside, and then again see inside out. समझ रहे हो? जो inside का part है, not infectious part, inside out. So now I am touching the non-infectious part. जो infection part था वो अंदर गया, and this I will put in red bag. All this we will discuss tomorrow. But is this clear? So you see this, just if you want you can note this down on YouTube. RRC KEMH, donning and doffing of PPE. You will get this video, you see that video. Very nicely explained. And you have to follow that. Always remember, especially in the time of COVID, do not doff your N95 in the doffing room. There is a donning area and doffing area. Once you start your postings, you will see this. Will you remove your N95 in the doffing area? No. Why? Because there might be aerosols around you. So remove everything else, keep the N95 on, come outside the ward where it is a non-clinical setting, and then remove your used N95 and put it in the yellow bag. Clear? Your safety should be the first priority. So you might not have idea about it, but just wild guesses. What type of PPE would you wear when you are suctioning oral suctions? क्या लगेगा? Any idea? Any rough guesses? Mask, very good. Goggles. So gloves is required, mask and goggles are required. Face shield, and if you are expecting splashes, then a gown. Responding to emergency when blood is spurting, gown, very good. Gown, gloves also you will need, eyewear also you will need. So gloves, fluid resistant gown, mask, goggles, or a face shield. So what about those who are wearing spectacles? Do they need goggles or protective eye gear? So yes. So just consider this, your spectacles are not a protective equipment. They are meant for refractory correction. So there is a gap from the sides. If you see the protective eye gear in the PPE kit, it is completely sealed like this. So there is no gap from where if there is a spot or anything, blood will enter. Clear? तो ऐसे मत बोलो मेरे को तो चश्मा. Yes, you will have more protection as compared to someone without spectacles. But still that doesn't mean you are protected. What about drawing blood from a vein? That is known as phlebotomy. Gloves only, very good. So this is known as rationalizing of PPE. Don't say कि मुझे पूरा PPE kit चाहिए तो ही मैं phlebotomy करूँगा. So this requires only gloves. In current situation, you need a mask because currently we are following something known as universal masking, which is just for the pandemic, not related to this condition. Overuse of PPE. You have seen this? First दिन TV पे आएगा ऐसे लोग. They are doing शादी with PPE kit on. What is the need? Where is the risk? So your PPE use should be based on the risk assessment of the procedure you are doing. Clear? And using mobile phone with a gloved hand. So you have touched the patient and now from you got a call or WhatsApp check करना है. किसी का message आया. You remove the mobile on your gloved hands. That's not going to work. You are transferring all the organisms to your mobile and taking that mobile home. Clear? Safe handling and disposal of sharps. This is important to you when you will do internship. Most of the needle stick injuries which we get, 80% of them are interns. So when does this needle stick injury happen? During the use, after use and during disposal. During disposal and 5% is other. So what is happening is, you are all aware of this, intravenous either injection or catheter, he or she is inserting, and here there is an injection, what we call as hypodermic needle, which has, the person is trying to recap and it has by mistake pierced even a gloved hand, imagine, and there is bleeding. You can see this, there is a drop of blood. So take a oath today that you will not recap needles. You will not recap needles at all as interns or whenever you encounter them. Is everyone with me on this? Never recap needles once you have used it on patient. Never. Okay? So not even this single hand, this all you might not know for now, but there is a single hand technique. उसमें एक हाथ से ऐसे sword जैसे वो ऊपर करने का और फिर ऊपर से उसको बंद करने का. No, even that time by mistake someone pierces. So whatever we get needle stick injuries, mainly they are during the recapping. So do not recap. So how do I dispose them? If sir is saying don't recap, so and never pass sharp directly in a container. Directly put it in a container to pass. This is mainly for the nursing when they pass the sharps to the surgeon. हाँ तो वो scalpel blade ऐसा सामने से नहीं देने वाला चाकू जैसे. They have to place it in a kidney tray and then pass. Okay. And like I said, never recap. So what should I do? Put the entire syringe with the needle in the sharps container. There is something known as sharps container, which is puncture proof. Understood? So no need of recapping. पूरा का पूरा ऐसे के ऐसे sharps container में जाएगा. Or if you have something known as needle cutter, then you have to insert the hub here and squeeze this to one of this lever, and it will cut the needle part. It will fall in this metal box so that no one gets hurt, and whatever plastic syringe is left with you, you will put it in the red bag. Is it clear? No, none of you 3-4 years down the line, I should get a complaint that has got a needle stick injury due to recapping. When you come in second year, I will personally know you, most of you. So I don't want to see your name in that list. It feels very bad, especially if the reason is recapping. And so you can see this in the wards. भरते रहते उसमें, भर गया फिर घर घर उसको इसके शेक करेंगे और थोड़ा सा जगह होगा और डालेंगे. So what you can see, overfilling. You can see there is a blood here. There are drops of blood on the walls. Imagine the poor labor staff who is going to lift this can for disposal. He or she will get exposed to hepatitis B virus, HIV virus, HCV virus, and other bloodborne pathogens. So never do this. Management of spills. Suppose you have collected blood in a vacuum or what you call as evacuated tubes, and you forgot to press the lid properly and it falls down, it spills or it breaks, and you have a blood spill like this. What to do? पैर से ऐसे हटा दो, इधर उधर देखो, किसी ने देखा नहीं है, कल्टी मारो. Right? That is the best method, right? Am I right? No. So first thing what you will do is raise an alarm. What do you mean by raise an alarm? I am there in the wards, you are there in the ward, ward boy is there, sister is there, nursing student is there. Tell them कि इधर spill हुआ है, so that they don't walk on it by mistake and get exposed. Then if you are not already wearing the required PPE, you or whoever, you can assign the labor staff for this. Not necessarily that you have to do. Give them the PPE to wear. If there is any sharps like glass or something, with a forceps they have to pick it up, put it in the sharps container, or there is separate box, cardboard box for glass. Then what you will do is take an absorbent material and put it over it till it soaks that blood. Lift it up, put it in the yellow bag. Again put absorbent like cotton or gauze piece on it. Put 1% sodium hypochlorite. Keep for 10-15 minutes. Lift it up, put it in yellow bag, and then mop it with a normal mop. What will happen if you mop it directly? Pura blood idhar se udhar, that mop is going to spread. And then they will use the same mop in your lunchroom. Understood? And why to use absorbent first and then put it in yellow bag and not directly sodium hypochlorite, which is a disinfectant? Because it does not act in presence of organic material. So you first reduce the organic material, you first reduce the biological load burden, and then you use the disinfectant. Sodium hypochlorite is a very good virucidal disinfectant. So it will immediately work on the hepatitis B virus, HIV virus, hepatitis C virus. But you should know that it has a contact time of 15 to 20 minutes. So abhi dal diya, turant uthana nahi hai, you have to wait for 10 to 15 minutes. So just go through it, wear the PPE, mark that area so that no one comes near, and place an absorbent, allow to soak, discard as infectious waste into the yellow bag. Again place absorbent, 1% sodium hypochlorite, contact time of 10 to 15 minutes, remove, discard as infectious waste, and then you use this chindi. And allow to dry. Now last, management of exposure. Like I said, you have stepped into this medical world, you are at more risk than any other person or common person on the roads to certain pathogens. So what you will do once you are exposed to this pathogen? What I taught you till now was protection. How to protect yourself from this exposure. But in spite of this, since it is a post-lunch session, some of you might be sleeping and you got exposed. So kya karna hai? That I will tell you. So this is mainly for the prick, needle stick injury. Once you are exposed, what you will do? First thing is, do not panic. This has happened with us also as interns. Once you get panic, once you get a prick, now you are not learned na HIV, HBV अभी तक पढ़ा नहीं है. अभी तुम बिंदास हो, सिलेंटेरेटा और टेरिडोफाइटा पे ही हो. Once you read, start reading ना, अरे ये disease तो मेरे को है क्या? अरे मेरा भी ऐसे है वैसे ही है. ये ऑथर ने ऐसे लिखा है वो तो मेरे साथ भी होता है. So once you get a prick by a needle which is used on a patient, you will go, अरे HIV हो जाएगा, HBV हो जाएगा. You will get anxiety. Trust me, बहुत होता है. There are people who have sent blood of the patient to all labs. मेरे को 2 घंटे में इसका report दे HIV का. Understood? So you get a lot of anxiety. So you don't have to panic. Do not press the finger. हिंदी पिक्चर नहीं है ये. सांप काटा तो ऐसा चूस के निकालने का है. उधर फीमेल इंटर्न देखी, भाग भाग के मैं रुक, मैं तुझे बचाता हूँ, और ऐसे चूज करके. No. So no pressing the finger. What happens when you press and release? There is negative pressure. So the virus will go deep into the capillaries. So never press the finger. वो पूरा ऐसा निकालने की कोशिश मत करो. What you have to simply do is running water. You start the tap, running water. Just hold your finger after you get the prick and let it bleed. Once your bleeding time is over, it will stop bleeding. Then, if it is an extensive cut, like with a scalpel blade, you have to bandage it. If it is just a needle prick, you cannot cover it. Okay. Inform senior, very important point. This is a very important point. I would like to re-emphasize that inform the seniors. Most of you think कि कुछ नहीं होएगा, and you don't inform the senior. Your senior is not going to be behind you. Means he will be behind you for work, but he is not going to see that you got a prick. Unless you inform, they will not know, and then you will miss the bus of taking the post-exposure prophylaxis, PEP. So inform the senior will advise you what to do. Or senior matlab second year, third year nahi. The faculty or the nurses there or whatever. Understood? And take the antiretroviral therapy, ART. You have heard this word, ART, antiretroviral therapy, which is for prevention of HIV. prevention or treatment. So this is post-exposure prophylaxis, that means prevention. First dose within 2 hours. Why? Because after 2 hours, it enters the CD4 T cells, CD4 lymphocytes. So you have to stop its entry by taking the first dose within 2 hours. If not by 2 hours, for some reason you could not take, then minimum 72 hours. Because after 72 hours, it will enter the memory T cells. And once it enters the memory T cells, there is no way to prevent the infection. Clear? So where is this ART center? I am telling you, 2 hours में लेना है. KM घूमे तुम लोग? एक चीज किधर है वो ढूंढने में 2 घंटा लगेगा. Right? You will start experiencing this in some days. एक बोलेगा 56 नंबर में जाओ, एक बोलेगा 16 नंबर में जाओ. किधर है क्या है वो ढूंढने में 2 घंटा गया. So where is the ART center? It is in new building, everyone knows or not yet? New building, ground floor is the ART center. So if you are working in routine hours 9 AM to 4 PM, you go to the ART center. If you are working in the emergency hours, that is holidays or after 4 PM, you have to go to the medical intensive care unit, that is MICU, which is old building, 2nd floor, ward number 22. They have the first dose. And next day you have to report to the ART center. Do not neglect this, please. So there is a 0.3% that after a needle prick, bleeding should be there. If there is bleeding, there is a 0.3% chance that you might, and the patient is HIV positive, you will also get HIV. But for hepatitis B, there is 30% chance of transmission. How many of you have taken the hepatitis B vaccine, both the doses? Only 1 person. So that is shockingly less number. All of you have taken admission into the medical course. In the next few days, you take hepatitis B vaccine. First dose, and whenever is the second dose, you have to take it from private physician if you want. Don't wait. Because we are constantly exposed to blood and body fluids. And like I said, 30% chance of transmission of hepatitis B from a positive patient to us on exposure. How many of you have taken COVID vaccine, both the doses? Good. So we will always be at an increased risk of certain pathogens. All of you, when you come to second year and meet me, should be hepatitis B vaccinated with 2 doses. Please, don't take this lightly. Everyone is clear? Last slide. This is for you. Be careful. Look out for each other. This is the fight of your lives, obviously. And hopefully you are going to win whatever it takes. Good luck.